1. What is the thyroid? The thyroid is a small endocrine gland located at the front of the neck, shaped like a butterfly. This organ plays a crucial role in regulating the body's metabolism by producing thyroid hormones, T3 triiodothyronine and T4 thyroxine. These hormones control various bodily functions, including energy expenditure, metabolism, and body temperature. If the thyroid produces too much or too little of these hormones, it can cause various health issues. 2. Causes of thyroid disorders. There are several causes for thyroid disorders. Genetic factors. If someone in your family has thyroid disease, you may have a higher risk of developing thyroid problems. Environmental factors. A diet lacking in iodine or exposure to certain environmental factors can affect thyroid function. Iodine is essential for the production of thyroid hormones, so a deficiency can impair thyroid function. Autoimmune diseases like Graves' disease, hypothyroidism or Hashimoto's disease. Hypothyroidism can attack the thyroid, disrupting its hormone production. Stress and hormonal imbalance. Stress and hormonal imbalances can also affect thyroid function and contribute to thyroid disorders. 3. Symptoms of thyroid disorders. Thyroid disorders generally fall into two categories: overactive thyroid hypothyroidism and underactive thyroid hypothyroidism. The symptoms differ depending on the condition. Hypothyroidism, overactive thyroid. When the thyroid is too active, the body's metabolism speeds up, leading to symptoms such as weight loss, rapid heart rate, anxiety, tremors, excessive sweating, and fatigue. Additionally, increased hunger, redness of the skin, and sensitivity to heat may also occur. Hypothyroidism, underactive thyroid. When the thyroid produces too little hormone, metabolism slows down. Symptoms can include weight gain, fatigue, depression, hair loss, dry skin, sensitivity to cold, constipation, and poor memory. 4. Treatment of thyroid disorders. Thyroid disorders can be managed with proper treatment after diagnosis. Hypothyroidism treatment. Hypothyroidism is typically treated with medications that suppress thyroid hormone production, such as anti-thyroid drugs, e.g. methimazole. Another option is radioactive iodine therapy, which reduces thyroid function, or in some cases, surgery may be needed to remove part of the thyroid. Hypothyroidism treatment. Hypothyroidism is treated with hormone replacement therapy. Levothyroxine is commonly prescribed to replace the deficient thyroid hormone. This treatment may be required for life. 5. Foods that are good for the thyroid. To maintain thyroid health, proper nutrition is essential. Iodine-rich foods. Iodine is essential for the production of thyroid hormones. Consuming iodine-rich foods like seaweed, kelp, nori, and seafood can help support thyroid function. Foods high in selenium. Selenium is another important mineral that supports thyroid function. Foods such as Brazil nuts, seafood, and some nuts are rich in selenium. Foods rich in vitamin D and iron. Vitamin D and iron are also important for thyroid health. Foods like fatty fish, eggs, spinach, and lentils are good sources of these nutrients. 6. Foods that are bad for the thyroid. Certain foods can negatively impact the thyroid. Goitrogenic foods. Goitrogens are substances that can interfere with thyroid hormone production. Foods like soy, broccoli, and cabbage contain goitrogens. While consuming these foods in moderation is fine, excessive intake can negatively affect thyroid function. Processed foods and excessive sugar. Processed foods and excessive sugar can lead to weight gain and inflammation, which can disrupt thyroid function. These foods often lack essential vitamins and minerals needed for thyroid health. Excessive caffeine. Excessive caffeine intake can interfere with thyroid hormone secretion. Consuming too much coffee or energy drinks can have a negative effect on the thyroid, so it's best to limit caffeine consumption. 7. Lifestyle habits to prevent thyroid disorders. Here are some lifestyle habits that can help prevent thyroid disorders. Regular exercise. Exercise helps regulate metabolism and maintain thyroid hormone balance. Consistent aerobic exercise and strength training. can help keep the thyroid healthy. Stress management. Stress can lead to hormonal imbalances that affect thyroid function. Managing stress through activities like meditation, yoga, and deep breathing exercises is important for maintaining thyroid health. Balanced diet. Eating a balanced diet that includes iodine, selenium, vitamin D, and iron is crucial for thyroid function. It's best to prioritize whole, unprocessed foods rather than processed foods. Regular health checkups. Thyroid disorders can be managed effectively when detected early. Regular checkups and blood tests to monitor thyroid hormone levels are important for maintaining thyroid health. Maintaining thyroid health is crucial for overall well-being as it plays a key role in regulating metabolism and energy production. By following a balanced diet, managing stress, exercising regularly, and monitoring thyroid function, you can help keep your thyroid healthy and prevent disorders.